Welcome to this bonus episode of the Shared Practices podcast. I'm your host, Dr. Richard Lowe. This week was a little crazy. I think I was at work for over 30 hours straight for presentation and my research and stuff that we have to do for my residency. So I apologize getting this one out a little bit late. I'm going to get another one out by the end of tomorrow, maybe late tomorrow night, with kind of our regular program. So this is a bonus episode from Dr. Cory Glen, he was the one who introduced me to Blue Sky Bio in the first place. And so I wanted to release this episode as a thank you to Blue Sky Bio for hosting or sponsoring 1 month of our podcast, the first month of season 2. And I actually called Blue Sky about a week and a half ago, and I told them, I love you guys, and I can't have you guys sponsor my podcast anymore. The reason being, I've got like a couple of gray areas overlapping here. So the first gray area, and I'm going to be completely honest, and maybe this will screw me over in the future, but whatever. I feel like I can't just like bottle this all up and hope it all plays out just right. So the first gray area is that while I'm in my residency, we're not allowed to moonlight. We're not allowed to work off-duty, have any off-duty employment. And so this right here, this podcast, this is a hobby for me, and my wife owns it. So any advertising, anything, this is all her business. I'm just doing this because I love it, and I'm going to help her out with her podcast, not my podcast. So that's gray area number 1. The second gray area is that anytime I do anything on the podcast, I can't make it seem that the Army is sponsoring or endorsing anything that I'm doing or saying or talking about. So I try not to bring up a lot of cases or things from my residency just for that fact, to steer clear of that, because that's not what this podcast is about. It's about practice management. So when I contacted Blue Sky, I didn't think that we would be able to use Blue Sky Bio's software and their products or anything like that while I was in my residency. I thought, oh, this will be cool. I think these guys are an awesome company, and sometime in the distant future, I'll be able to merge my cone beams and my scans and digitally plan my implants and then fabricate guides. That's something I'll do in private practice once I get out of the Army. So, this will be awesome. I love working with companies that are passionate about what they're doing, that do things open source and have amazing planning software for free for anyone to download. So I thought, okay, this will be a great sponsor. This is one of the reasons I'm doing this podcast, is to build relationships with good people and people that I want to talk about on the podcast. So I reached out to them, and they said yes, did some episodes, and I realized, I was like, wait a second, I could actually do this at my residency. We've got a cone beam, and we've got some scanning capabilities with our in-lab from CERAC, and that's all you need. You just export your cone beam file, you export a scanned model, and then you merge those in Blue Sky Bio's free planning software. And then you can plan your surgeries, and then you can export a guide and send that to a 3D printer. And the Army has a 3D printer, and they're actually doing guides like this at another residency at Fort Gordon. So I realized we've got all of the expensive pieces, the in-lab software, our cone beam, the 3D printer at the Army Dental Lab. We have everything. We're just missing this last little piece, which is a free software that Blue Sky Bio provides, and a way to export that. You got to pay the export fee of $25 if you're just buying a few for each guide that you export out of the program. And once I realized that, I kind of went on a warpath of, okay, let's get this set up. How do we get this going? How do we get the software? Oh, it's free. Okay. I contacted the other residency that's doing it. How do you install this? How do you get everything going? And within 3 or 4 weeks, I found myself submitting approval to get funding, to get credits for Blue Sky Bio and all these different things. So it went very quickly from something that I hope to do in the future and has no interaction with my day-to-day life to now I'm lecturing other dentists on how to use Blue Sky Bio to plan their implant cases and print guides. So I feel like I don't want there to be any misrepresentation that the Army is endorsing Blue Sky Bio, and I don't want during the daytime when I'm lecturing and teaching co-residents there to be any sort of misrepresentation that my presentations are sponsored by Blue Sky Bio. So, and you could say, well, people do that all the time. Well, in the Army, it's kind of a big deal. And unlike maybe say a normal residency or normal dental school, you kind of go home and you can separate your work and your life. Part of being a dentist for the Army is that they own you. You're an asset of the Army for the time that you're in there. And so there's a lot of layers of bureaucracy, and one little thing, one way or another, can be a big stumbling block to your career, to your getting things done, to the relationships that you have. Things can blow up. So you have to be very careful about things. So I was feeling conflicted. I was feeling kind of stressed about this whole like, oh crap, here I am giving a lecture to my co-residents, and I'm kind of getting known as the Blue Sky Bio guy. And I could see this blowing up mid-presentation when one of the mentors made a comment saying, oh, hey, so is Blue Sky Bio sponsoring this presentation? And my program director looks at me and says, wait, what? And things could go south pretty quick. So rather than continuing that relationship with Blue Sky Bio, contacted them right away and said, hey, thank you so much for being willing to do this and to do this non-traditional advertising method. And he said, well, we're kind of kings of non-traditional advertising because their whole planning software that's free, that's cutting edge, that's top of the line. He said that's our most expensive non-conventional advertising. Is they said that we provide this software for free so that people can do this digital dentistry, this advanced dentistry, and they don't have to use us. But once they see that this is what we value, is giving dentists the tools to have more predictable, more safe, more cost-efficient surgeries, then they're going to say, oh, okay, well, maybe it's worth looking at other stuff that we've got going on. So he said, we ended on great terms, and maybe someday after my residency, after the Army, I'll continue to lecture for or work with Blue Sky Bio. But as of now, that is done, my initial little obligation with them, and I'm going to have to move on and find some other sponsors. But I just wanted to have this last episode because I agreed to do so many episodes of sponsorship for them, and to tell you a little bit about the things that I would have gone into over the next couple months if they had continued to sponsor season 2. So the first, and Cory and I get into this in the episode, the first awesome part about Blue Sky Bio for me is their planning software. So when I think of like expensive premium software that you really want, but is obnoxious to pay for, I think of Adobe. So Adobe Photoshop, Adobe Audition, which I'm using right now to record this podcast, Adobe Premiere, they put out top-of-the-line software. And they have dominated these different areas and have a market share where certain professionals, they've grown up using this. This is what they're locked into. So what did Adobe do? They went and said, okay, instead of just putting out a new version of our software, because sometimes people, they realize, oh, hey, I've got Photoshop from 3 years ago. It's still good, even though they came out with a new version of Photoshop. I'll just keep my old version. I'll just keep plodding along, doing my thing. I don't need the latest version. I don't have to pay another $100, $200 for the latest and greatest. Well, Adobe said, oh, that sucks. Like, people aren't buying the same version of our software over and over. What can we do to get more money out of this? So they decided to make a subscription model. So now, in order to have access to all of Adobe's software, you have to pay $50 a month. And so that's $600 a year just to use their software. And there's really not another good way to get access to Photoshop and all these other things, unless you just buy one of them, and then it's like $20 a month. So Adobe did the greedy corporate thing with their software to make more money. It's America. I guess that's what we do. Blue Sky Bio went the other way around. They said, okay, we have these amazing value priced, but top of the line implants. We have all these other things that we could do. What if we provided top of the line implant planning software for free? And then they said, okay, if we're going to do this for free, let's make this open source and play well with other software, with other units, with labs. Whichever lab wants to use us, they can use us. They don't have to use our implants or our cone beam or our scanner. It plays well with everyone. So after downloading this and playing with this and getting to use it, I actually had to go look up a bunch of other implant planning softwares. And I found another I'm not going to mention the name, but there was another piece of software that did the exact same thing. It allowed you to import a DICOM, import a scan via STL, merge them, plan the implant, and then export an STL file, basically a guide file, to be printed on a 3D printer. And it was $6,000 up front and $600 a year of maintenance fees. And then it was $60 per export. So this really is an amazing service that they are putting out updates and maintaining the software at the cutting edge. They're looking at incorporating not just implants and all these other things they've been doing. They're actually looking towards ortho. They've released the beta version of this software where you can move teeth digitally, print the model, do a suck down, and now you've done your own in-house version of Invisalign. So whether you're just trying to move a few teeth a little bit, rotate them here and there, you can do that with this software, and you have complete control. That's the other thing I love about it, is that you can do fully guided, you could do pilot guided, you want just the angulation guided, or you want also the distance that your drill stop goes. You want to put keys in, you have custom keys from this company. Okay, well, we can incorporate that in the software. The software is so powerful and so customizable. Do you want the distal extension of your guide to be soft tissue supported, or do you want it to be on bone? Okay, there's a way to merge two files together and have a little bone support so that your distal extension is absolutely rock steady and it's not moving on you, which would be a problem if you've got a distal extension. You're trying to do a implant drill through that and it's moving around. It's amazing. And I'm so excited to use it myself and to be able to share it and talk with people about it. It's something that my people who know me are sick of me talking about it already, even though I've only been using it for just over a month. So if you haven't downloaded Blue Sky Plan yet, and you are doing implants, just download it and play with it. It's free. The one caveat is that you have to have a pretty decent computer to run this. It will tax any crappy computer. So you're going to need a computer with good RAM, good processor, good graphics card. So, sure, download it for free and mess with it. I think you get 2 free licenses when you download it for free. So the one last story I want to tell before getting into the interview with Cory was when I was trying to find the contact information for Blue Sky Bio, for the head of advertising. I asked Cory, I was like, who would I contact for getting a sponsorship on the podcast? And he's like, well, they don't really have an advertising department. I was like, what? Okay. He's like, here, have John Carey's contact info. He's the general manager of the company. It's like, the general manager? Okay, the guy that runs the company. So he gives me his number and his email. And then I go on their website and I'm looking around. I'm seeing some like different area codes for all of the different support phone numbers and different headquarters. Like there isn't a main headquarters that I can find. I'm like, what is this company? I'm kind of confused. So I eventually just cold called John Carey, the general manager of Blue Sky Bio. And I told him about our podcast and how we'd love to work with them and maybe have them sponsor the podcast. And he was like, okay, that's interesting. He said, one of the things that's unique about us, I don't know if you know this, is that we don't have a big headquarters. We don't have a massive sales team. We don't have a bunch of different departments. He said, there's me and a handful of others in kind of the executive team or board or whatever. And so I like this idea. I like what you're trying to do. Let me sit down and talk with them. And I'll get back to you within a few days on whether we can sponsor your podcast. I was like, oh, sweet. And I realized, and he told me, he said, if you have a sales force of reps who are out in every major metro in all of these different markets and who are flying all over the place, you have a ton of costs wrapped up in that. Same thing with the real estate for the locations and headquarters and maintaining buildings and facilities and all of the people and infrastructures to support all of that. He said that these implant companies have a ton of overhead, and so they have to charge more for their implants to cover all of that and still be profitable. So, he talked about, we have chosen at Blue Sky Bio to structure our company in a way that is only possible now because of the internet and everything that we can do online. We are a very low overhead company, and we can pass that along in the implants that we make. And so The reason that you can buy an implant and a cover screw and a healing abutment for $150 and there's no like, oh, we'll call your rep to get the full pricing. And then you find out it's $450 and it doesn't come with a cover screw. The reason they can do that is because they've thought about things ahead of time and said, let's do this differently so that more dentists can afford to place more implants and so that more patients can afford to get implants. If the dentist wants to make more money, they can do it that way. Or if they want to lower their fees and do more for patients that maybe wouldn't have been able to afford implants, they can do it that way as well. There's so much more I could go into, but I won't because this is already like 15 minutes of me going on and on about Blue Sky Bio. I'll get to the interview here. So here is my last ad for Blue Sky Bio. If you go to blueskybio.com and you load up with any of their awesome implants and mention the Shared Practices podcast in the additional comments box on your order form. So if you order at least $500 worth of anything, you get $200 off your order. If you have absolutely nothing, you aren't placing any implants, say that you're an associate somewhere and you're like, man, I don't want to spend 10, 15 grand to buy a motor, to buy a bunch of implants, to buy the drill bits and all of the little components and pieces that you need to be placing implants, you can get one of their implant starter packages. And there's a couple different starter packages depending on how big or small you want to start. My favorite one comes with 10 implants, the motor and the motor unit and a handpiece and the irrigation setup and tubing, as well as the drill bits that you need to place the implants for just over $5 grand. This makes placing implants as a new associate, as a new grad, very much in your reach, even if the owner or the office that you currently work at has absolutely nothing. You can get going on your own. This will pay for itself time and time again. You can take it with you when you move to your next office or to owning your own practice. It's a phenomenal deal. So to save another $250 off of this starter package, mention Shared Practices podcast in the additional comments. Restricted to one use per provider. Some restrictions apply. Okay, we have with us today a guest that I didn't initially even hope that would be on the podcast. This is Dr. Cory Glen of MacGyver fame on Dentaltown and YouTube and pretty much everywhere at this point. Welcome to the show.
Hey, man. Thanks for having me.
We met, I want to say it was 2014 at the Townie meeting. Yeah. And this was, I don't know if I just didn't know about you yet or if you weren't a big deal yet. Like, was this pre-Rising Star Dr. Glen?
I was not lecturing much at that time. I was just doing some kind of local AGD meetings.
Sure.
So I was posting a lot, but, as far as like being on the speaking circuit, I wasn't really doing that much yet.
Okay. Yeah. So I kind of met you and then like I just saw you like cropping up everywhere after that. So it was kind of crazy. I was like, oh, he just like sat and talked with me for an hour at lunch at Townie. It was like a super chill guy. And then you've got all these amazing techniques and videos and lecture series. And so it's been really fun to see everything you've done since then and to say, hey, I know that guy. So thanks for being on the show. So one of the things I talked about in season 1 is that if you want to be a business owner and you want to learn how to run a practice, you can figure it out. And that drive and that desire, I wouldn't say is key, but is definitely helpful to make it a financially successful venture and to mitigate the risk of student loans versus practice ownership. But right. You've come out and you've admitted that you don't love running a business. Is that accurate?
Yeah, that would be very accurate.
Okay.
So I'm the stereotypical, just wet-fingered, just want to do the dentistry and not have to mess with the business side of it. I mean, that's all me. I would much rather be taking pictures and just doing different techniques than I would running payroll. In fact, I don't run payroll. That, without my wife, I would be, living in a gutter down by the river. So
sure.
She's helped me a tremendous amount with that. But yeah, I don't really love the business aspect, and yet we've been pretty successful in spite of ourselves. So I guess there is something to be said for really loving the clinical aspect of it. And, that kind of pushes me to be able to do the other stuff, even though I don't enjoy it.
Well, you kind of got not pushed into, but you had a very early opportunity to jump into practice ownership. So tell me the story. You were getting out of, I think you did a 1-year AEGD somewhere. Is that correct? Yeah,
I did a 1-year AGD in Memphis at my alma mater, and had talked with a guy, and I was kind of going to go in with him in a town not too far away from here. And, we had at least verbally agreed on a lot of stuff. And then when it came time to sign papers, it just wasn't really the same things that we had talked about. So ended up backing out of that deal. And, it was like a few months left in residency. And so I didn't have a clue where I was going.
Right.
So just on a whim, I happened to hear another friend tell me about a practice he had looked at in a little town called Winchester, which was about 4.5 hours away from Memphis in Middle Tennessee.
Okay.
And so he suggested I just go look at it because he had thought about buying it, but decided he wasn't ready for ownership. So since I didn't have any other plans, I decided I would. So I called it up, and it was a weird situation. The dentist was very ill. He had a glioblastoma.
Oh, no. Okay.
And, very, very good dentist, good reputation and everything, but he had this come up, and so for a year he'd been doing treatments and things, and it was just going downhill. And so actually showed up in town and, showed up at the practice, and nobody's there. I'd driven like 5 hours to see this practice.
It's empty and the doors are closed.
It's empty. So I start making some phone calls, and poor guy, I mean, it was obviously affecting his brain. And so he hadn't remembered that we had set this up. But anyway, everybody scrambled and got it together and met up there. And so it ended up working out. So I met him, nice guy and everything. Unfortunately, that was the first and last time we ever met. He died about 3 weeks later.
Oh, no.
So anyway, the practice is obviously for sale. I mean, they didn't have a backup plan.
Sure.
And so I wasn't for sure yet that I wanted to buy it, but what we decided to do is I had a lot of vacation days saved up in my residency. So
okay.
I would work Monday through Thursday, and then I'd drive 5 hours to Winchester, and I would work Friday, Saturday just to keep the place alive.
Oh, man.
And so we did that for a couple of months while I worked out with his estate, trying to come to terms on some kind of a purchase agreement.
Yeah.
And eventually we did. And just given the situation, I did get a really good deal on the practice because it was just going to kind of be, trial by fire. There was no transition period, no one to really hold my hand. I didn't know how much of a financial hit the practice had taken in the absence of a doctor. So I kind of lowballed just because there were so many unknowns on my end. Thankfully, it worked out really, really well. I don't think we lost more than probably 5 or 10 families through the whole transition.
Holy cow!
Most everybody gave me a chance, and so we were extremely busy from day one, and that just kept getting busier and busier through the coming years.
So you essentially walked straight out of dental school residency into practice ownership, not knowing how to run a business, not knowing how to file insurance or do all these different things, but you figured it out, despite being, like you said, not someone who was up late at night, maybe on Dental Town, like pouring through all of the business threads. You were reading the clinical threads.
Right. And one of the things that this practice had going for it is that they had a long-term staff that had been there for a long time, knew their jobs well and did them well. And so I inherited this staff, and to be quite honest with you, for the first, I don't know, maybe 6-8 months, more or less, they were kind of running things and just telling me what to do. I didn't know about insurance and all that. My wife had run an orthodontic office, and she's also a hygienist, so she's working up there and she's learning on the job. And
that's cheating. I mean, you've got a wife who's run a practice and a hygienist. That's not fair.
Well, she was a receptionist at the orthodontic office, but she's extremely knowledgeable, and she knows what's up. So, that was very, very helpful. And I couldn't have probably done it the way I did without her. But she would do hygiene, which helped me a ton,
right?
Because I didn't have to pay her near as much. And then too, she was able to work up at the front desk and kind of learn the systems and how things were going. And gradually we transitioned from where it was the staff running things to us kind of changing over, okay, here's how we want to do things. And so it was a transition over a couple of years to do that. But, Our accountant is semi-family too, and she was extremely helpful in telling us, what we all had to have on the tax side of things, and advising us on where to spend money and all this kind of thing. So I guess the point of that is no one person is going to be able to do it all. You can't do the clinical and buy the equipment and know how to do taxes and payroll and all that. You do have to have some resources that you can lean into. So for me, that was my wife, the accountant, and a few other people, a few other older colleagues that I could ask questions of. So I think it's pretty important that you just get some knowledgeable people that are willing to help you and hold your hand.
Well, and that's awesome, is that you don't have to do this alone, and you can't do it alone, in fact. So that's a great point. And anyone who feels like they can't run a dental practice, or it's too much of a risk because they're not a business type, needs to surround themselves with the right people. And you just happen to marry one of them and then inherit a lot of them. So you really were pretty fortunate, it sounds like, but
very fortunate.
It all worked out. So the way that you practice right now, if people follow you, they know that you're doing a lot of pretty amazing restorative and implant dentistry. Do you feel like you could do the same clinical, not that you're experimenting, but stretching of your boundaries if you were an associate somewhere versus an owner?
I don't think there's any way that I could. I mean, I think about a lot of the stuff that I do, and I guess some of the stuff that I'm kind of known for that has gotten traction on Dentaltown is just trying these wild techniques that sometimes happen to work out. And I just try to think, if I was in an associate position, one, I would be pretty gun shy about trying that on, people who weren't necessarily my patients.
Sure.
And then two, how do you handle the lab bills? How do you handle the time? I mean, if you've got some base guarantee and you decide you want to spend 4 hours on an experimental procedure one day, how does that work out for the owner doc? They're kind of getting a raw deal on that. And so it really did afford me the opportunity to stretch myself. If I saw a case that I really wanted to do because I knew it was a great learning opportunity, heck, I'd discount it by half or more. I've done plenty of that. That's much cheaper than having to go to a CE course and taking 3 or 4 days off of clinics. So, I'm able to do things like that. I'm able to kind of control all the inputs into the system. I control the lab bill, I control the staff cost and everything. So when you can do that, what you can stand to risk in cutting deals for people, I guess.
Well, and you mentioned, so this is going to sound kind of creepy. I've been listening to probably 3 hours at 2x of you on different podcasts for this evening in preparation for this interview. But you've mentioned on other podcasts that sometimes you'd almost do this clinical dentistry for free. Like, this is something that you love, and sometimes you do it for free. You just decide, hey, I want to do this case, and this person can't afford it, but I really want to do this, so you go for it.
Yeah, I mean, perfect example is that partial exodontic technique. I saw those guys posting about that, and I thought, oh my gosh, this is awesome, but who's going to let me try this?
Right.
And so, guy came in with the tooth busted to the gum line. I said, listen, dude, let me try this technique. I'm not going to charge you a dime for it, and if it doesn't work, you're no worse off because we still need to pull the tooth. But if it does work out, you can just pay me for the root canal and the crown. And of course, he thought that was a great deal, and I got to try it, so it all worked out.
So describe it briefly for our listeners.
Yeah, partial exodontic technique. So a patient comes in, let's say it's number 7 or 8, and it's broken off right at the gum line.
Sure.
One of those that you don't have a chance of a crown holding, even with a post and build up. It's just not going to work out. So what you can do with this technique is you can gently luxate the tooth and get it loose, and then pull it out. But basically, you just pull enough of the tooth out that you've got enough to restore, and then you just stop right there, and you throw a suture around it, and this little nub is just halfway out of the socket. And what was amazing was even at 24 hours, man, that thing had really tightened up. And so you give that 8 weeks, and then you do the endo on it, and by that time, the bone reforms at the apex. It maintains a PDL. I mean, it's an amazing technique, and then you just restore it like a normal tooth.
So it's basically like orthodontic extrusion, but cheating.
But really, really fast.
Yeah, you just say, hey, why wait around? Let's get this thing out of here. So,
and the unique thing here is you don't actually splint this. So you don't put fishing line on it. You
oh,
don't
no
put a
way.
wire, nothing. You do a single suture. And I think that's part of what makes this successful in keeping from having ankylosis. And so the tooth will maintain its mobility and everything. It's pretty amazing.
So you've got a video of that, right? So if people wanted to go watch
Yeah, it's
that
on YouTube.
on YouTube, okay. So we'll have a link in the show notes to that. So along with plenty of other YouTube videos there. So that's I wanted to get you on to talk about some of the non-financial, paying down student loans and all these other reasons to own your practice, but just being able to really push your skill set and go beyond what you thought you might be able to do or were comfortable doing.
Yeah, I mean, it does. It affords you a lot of possibilities that you just can't do, as an employee. So, if I want to come in on a day off and spend all day with a single patient, I can do that. So there are a lot of advantages in being able to push yourself. Not to mention, you're going to have probably a much higher income that will afford you to go take, whatever courses and things that you like, and the ability to schedule time off to do that.
Exactly. So, okay. One question I had for you was AEGD and residencies versus aggressive private CE. Because now you've kind of done both sides. You did your 1-year residency coming out of school, and then you've been involved in both participating in and teaching private CE courses. If you were to do it all over again, would you recommend an AEGD? And we're gonna qualify this as like a good AEGD that gives you a surgical foundation, that really expands your skill sets, that has great mentors. So if you had a slam dunk AEGD lined up versus going out into private practice and kind of learning on your own and learning online, what would you recommend to a new grad right now?
Hands down, do the residency.
Okay.
And there's a number of reasons for that. First, just the building up of your confidence, of your speed and everything, so that you are ready when you get into private practice. But the other aspect, I mean, I made, I don't know, maybe $35,000 a year during the residency, but I got my training in implants. I got the confidence to do that. When I came out, we actually got to go to Pankey Level 1 as part of my residency.
Oh, no way.
I learned how to approach these complex cases. And so, when you get out, especially, a lot of the guys listening to this podcast, they're going to be so focused on the business stuff that it's going to be like, man, there's no way I can take time off to go to this course or that.
Right.
And so what happens is to get the same amount of stuff is going to take now 7 or 8 years to fit into your schedule, whereas I compressed it all into that one. And I was just talking to someone about this the other day. He does IV sedation. I don't. That was not part of my residency.
Right.
And I'm looking at it now on this side of things, wishing I had it, because for me now, the course to take it and get certified is like $19,000, but that's not even the expensive part. The expensive part is that you've got to spend like 3 weeks away from your practice. So
right.
Let's say that's $25,000 a week. So now IV sedation is going to cost me $80,000
right.
In production and all this kind of stuff, and time off and employee pay time. It's not as cut and dry as, I can get out and make a bundle of money, because it costs you a lot more to be gone. You're going to be more hesitant to go and do those things. So everyone talks about getting out in their first year and taking 300 hours. I don't know anybody that does it, though.
Yeah.
So I think the residency is very beneficial.
Cool. Well, and you're making me feel a whole lot better about myself. There was a period of the first few months of my residency where I was doing this podcast on the side, and my residency was all like workup and evals and mounting and case presentations, and we weren't actually getting to the surgeries and the cases. And for a little while, I was like, did I do the right thing? Like, is this the right thing? And now it's all coming together, and I'm doing perio surgeries, and I just placed my 9th implant, and things are going really well, and I'm really happy. And but I that's just a great perspective from you as a business owner.
Yeah, and another thing you're getting to figure out is what you don't like on someone else's dime. So, I got out, and, I went and spent a ton of money and took this orthodontic continuum, and I probably got $15,000 worth of ortho supplies in the cabinet to decide that I hate it.
Sure.
And I wasn't going to ever do a case. So it's always nice to figure out what you want to do on someone else's dime.
No, absolutely. And for me, we just did a pedo OR case, and man, that was like heartbreaking to see these little kids, but be able to do the dentistry and see everything and realize like I have so much more respect for pedodontists and being able to refer these difficult cases over to them. And if I had never sat in on an OR case like this, I just wouldn't even understand both what a service it is and how grateful I am that I don't have to do that kind of thing on an everyday basis. So, another thing you've mentioned in a couple of the podcasts is that you are a big proponent of documenting and taking pictures and taking video. And you've done this to an amazing degree, to the point where on some of your YouTube videos, I've been meaning to ask you how you get such stable shots of your clinical dentistry, like video shots of your clinical dentistry. What are you doing?
Yeah, so I've got a few different things. So some of the videos, if you see my head moving around, so that's an HD loop cam. That's the name of the company is HD loop cam.
Okay.
Really, really good, very lightweight little camera that goes on my loops. And the nice thing with it is it's always exactly what I'm looking at. And so no easier way to do that. In fact, I had recently rigged up I rigged up an overhead monitor in the hygiene room where we do all our new patient exams, so that when I come in, I hand her my cord and she can stick it into the computer and the patient watches their exam live. And so if I see, hey, Ms. Jones, do you see this, the crack on this tooth? And, she's seeing it in real time while I'm looking at it.
Yeah.
So I think that's a pretty cool thing. I wear that 24/7. But if I'm trying to get those super, super stable shots like you are mentioning, that's from a microscope.
Okay.
And so, a microscope is going to be the absolute gold standard on documentation. But gosh, I've struggled with the learning curve on that, probably more than most anything in dentistry. The lower arch for me with the microscope is just very hard.
Yeah.
So I would like to push through and get better with that, but it's tough to slow down enough to do it.
We've got some scopes in our endo department, so I was doing, maxillary premolar endo with a scope, which is kind of overkill. You probably don't need it, but it's so nice just being able to see.
Oh, it's amazing!
Everything's so big.
The magnification. I mean, and the light. You can't. It's hard to go back once you've had it. It's like getting stronger loops.
Right. No, absolutely. I'm going to throw in a marker right here. I keep hearing some stuff from your microphone, moving around, pushing, shoving stuff going on. So I just didn't know if there was the desk was moving or something like that.
Maybe. I'll move around different place and see.
And I'll just cut all this out.
Okay. All right, let's give it a try.
Okay. This is going great, by the way. Okay, so what would you recommend in terms of documenting cases to a new grad who, they're an associate somewhere, or maybe they're still in dental school, or maybe they're starting their own practice, and it's kind of a pain to buy a camera and learn how to take pictures and to stop the procedure and pull it out and take the pictures and then remember to actually go back and download them or look at them. What's the value and why is it worth it to go through all that hassle?
Well, there's a number of things. So, some people are really good at talking with patients and building that trust and confidence, and that's great and wonderful. And, some people might say that they're good salesmen and stuff. I never liked having to do that. I mean, I can definitely talk to patients and explain their needs, but most of us dentists are not the greatest at that. And it's so much easier if you can just, a picture's worth 1,000 words. So if there's a patient that's got a broken tooth in hygiene, I can just come in with the camera. I can shoot a picture real quick. I've got the iFi card in there that will wirelessly upload it to the server. And within, 30 seconds or so, I can pull it up on the monitor right in front of them and, say, here's the situation your tooth is in right now. And we really need to put a crown on it. And so it takes the burden off of me to have to do a lot of explaining or convincing the patient of why to do it. It's kind of like, here it is. You know what you need. So if you want to do it, great. If you don't, okay, that's fine too. But I don't feel like I have to twist their arm or talk them into it or worry that they're not understanding. And then the other thing, especially for these guys starting out, you've yet to build a rapport with the patients. You don't have their trust yet. If they've been with the dentist for 30 years, they don't need to see the picture. You just tell them they need it and they're going to do it. But that's not the situation for most dentists. And so I would say, having that really takes the burden off of you, because then they can own their problem. And furthermore, if you don't photograph, it's tough to get better. And so when you photograph things, you see, problems that you didn't know you had before. Everything looks worse when you blow it up at 40x. So
it looks way worse. We have to do
way worse.
Case presentations we just did it last week, and I presented on my lack of primary stability on these 3 implants that I placed a couple of weeks ago, and kind of what I did, and ended up kind of saving it, and fingers crossed that everything integrates and things move on. But when you throw that up there and present in front of people, or you post it on Dental Town, or you share it on a Facebook group, you learn, and it's a little painful and embarrassing, but it's totally worth it.
It absolutely is. And I mean, there's great forums like Dental Town, like the Restorative Implant Protocol Excellence group on Facebook, where you're going to get real feedback on stuff, and you're going to get it from the best people in the world. I always tell the story about, first full mouth rehab that I did was on a guy that, I posted everything, and Lane Ochi jumped in and started answering my questions.
No way.
Beverly Hills prosthodontist, and ended up more or less holding my hand through this case, because he saw, I think, that I wanted to learn, I wanted to do an excellent job, and he was willing to help me. So you can actually look back and still find that case of, Lane holding my hand through this whole thing.
Yeah, absolutely.
And how do you get that if you don't have pictures? You post a 40 paragraph thing describing that no one's going to read, because they can't see what you're talking about.
Sure.
So you got to have the pictures, man.
So if you were to recommend to someone to get, some people are like, oh, well, your smartphones are good enough. And then some people say get like a middle of the lane, like Canon G16, that's a little easier. And then there's the next level, which is the true DSLR with a macro lens and a ring flash. What would you recommend on that continuum?
I mean, so I'm a photo nerd, so a DSLR is always going to give the best pictures, and that's what I use. And I've got big old gorilla hands, so it's not hard for me to wrangle this, but they are heavy and bulky and all that. So a lot of my staff, they do have trouble holding that, because especially if they're taking pictures by themselves, they might have a mirror in one hand and the camera in the other. And so that can be difficult. So I would always want to have a DSLR available to me. But I have some other stuff too. So Blue Sky recently started selling a camera it's a modified point and shoot that's got a diffuser that uses the regular flash and a little extender. And so it's a camera under $1,000 that can pretty much do pictures that I would say are 80% as good as the DSLR.
Okay.
Color may not be quite as good, but you can get everything you need, and it's super easy to hold. And so that would work great if I was getting one that just my staff was going to use, like, for my hygienist to have in the room to use unassisted.
Right.
I would get something like that, or the Canon G series modified type. And then, intraoral camera, I'm just not a big fan of them. They're too small. They're too grainy. I've just never been impressed with the pictures I've seen out of those. So I think you're far better off to get one of those mid-range cameras and some mirrors than you are to try and do intraoral cameras.
Okay. So, and that would be for your everyday helping patients understand what they've got going on and co-diagnosis and case presentation. Your staff can use that. And then for the big cases that you're learning from and that you want to document and maybe share or present or do whatever you want with down the road, then you've got your DSLR that you pull out and take the photos the right way, I guess. So yeah,
Right.
that would be the balanced approach.
Yeah, and in lieu of doing an intraoral camera, some people will spend a lot of money to buy these $3,500 intraoral cameras for every single room.
Ugh.
In lieu of doing that, I would suggest looking into one of those HD loop cams like I've got, because then it you wear it and it goes room to room, and you can get a real time view of things, and it's just as simple as having your assistant click the mouse and they can take still shots, or you can record. And so I think that offers a lot more flexibility, and you can get one fully loaded for with multiple lens focal lengths for I think around $4,000 or $5,000.
Okay.
I think that's a much better investment than multiple intraoral cameras.
Well, and if you're going to buy multiple intraoral cameras, they're all intraoral, so buy the friggin' eBay ones or Amazon ones for $150. If that's kind of the quality you're going for, then
right.
Okay. So that's some awesome stuff, both from case acceptance and patients, and also just getting better and overall improving your clinical dentistry. I think there's no better shortcut than documenting your cases. So I was glad to get your perspective on that. With your experience, you had something that kind of came along in your life that you didn't expect to be there. And we talked about some of the financial preparedness for practice ownership. We talked about, having some savings on hand in case emergencies or sickness or, things happen. We didn't really get into any sort of disability insurance. And I've got a buddy recently who actually just found out that he's got a bulging disc right above S1, and it's scary for him. And luckily he has disability insurance in place, and he's got some things going for him. But we all feel like we're never going to get old. We're never going to get sick. We're all young and healthy and invincible. But you've had some experiences that might convince other people that maybe it's worth looking into some disability insurance or some other things. So tell me your story of how you found out about what you had going on.
Yeah, so I, this was 2015, and I was kind of at my peak. I had started lecturing all over the country, and was just go, go, go all the time. Practice was hitting record numbers. I tell people, I was 33 then, and really felt like I'd pretty much achieved everything that I knew success to be at that point.
Right.
I had a nice house and cars and the family and all that kind of stuff. And then just started feeling real crappy. I was having these weird symptoms with bruises and cramps, and my back was just killing me all the time. So finally went to the doctor, and he said, well, you're just overdoing it, blah, blah, blah. So I got a call back from him one day right before lunch a few days later, and thought that was weird that he would call me at the office. And he said, hey, man, I got your blood work back, and I got to tell you, it doesn't look good at all. You've got pancytopenia, which is when all your blood cells are absent. And he says, I don't know what's going on, but I've canceled your follow-up appointment with me and made you one for Tennessee Oncology. You need to go and be prepared to get a bone marrow biopsy. So just totally rocked my world.
Yeah.
Did the bone marrow biopsy, and then got the call the day after Christmas in 2015 that I had leukemia. And so that was just so crazy, because here I was, feeling like I was in my prime,
right.
And this just took me by storm. And so he called me and said I had leukemia, and drive to the hospital. You're about to start chemo.
Oh.
And so, we drove that afternoon to Nashville, and I spent the next 8 months doing chemo. Wasn't able to work because of the chemo regimen. It was every day. I would, after I got out of the hospital, I would drive 2 hours to Nashville. I would do 3 hours of chemo infusions, and then I would drive 2 hours home, and I was just tired and didn't feel good. So I couldn't have worked at all, even if I'd felt like it. So, yeah, if I had not had disability insurance, I would be so royally screwed that I don't even know what would have happened. I mean, it would have been not good. And so that to me is extremely important, that anyone listening to this understand how valuable your hands are, and that if you lose those, you are just in so much trouble, because Student loan debt, you can't be forgiven out of that. You pretty
Right.
much got to die out of that debt. So you've at least got to have enough to cover all your expenses, but you need something else to live on, because what does a dentist do if they can't do dentistry? You know,
Right.
I
Surf
mean,
Dental Town.
yeah, I mean, we're kind of one trick ponies. So
Sure.
I would say that you got to have enough that you can live on. And thankfully, I had a lot of good people give me that advice. They said, every time you can, max out your disability. So when my income went up, I always maxed out the disability. So I was pretty much either at or just barely under the cap of whatever the max they would give when this all went down. And so, there's a 3-month waiting period before it kicks in. But once it did, I didn't have any financial worries to worry about. We were able to pay all the bills and all that kind of stuff. And, that's been really important, because I don't know if you even know it. I'm actually back on disability now because of some lingering back issues
Oh,
from
no
all.
way. Okay.
Yeah. So I worked about 4 months and it was just killing me. Was having to take narcotics at night just to feel
Oh,
normal, even after working just a couple of hours. So went back on full disability, and we're trying to figure out some different options for that. But at least at this point, I am back on full disability. So, man, if I didn't have it, I don't know what I'd do.
well, I remember Howard getting some specifics out of you. I think did you end up using Guardian?
Yeah, I've got Guardian insurance.
And were they pretty good to work with?
They have been. I can't say anything bad about them. The process of getting enrolled, I guess is what you would say, was very simple. When you're on full disability, you pretty much have to just fill out a paper a month and then have your doctor fill out a paper a month just saying, here's what's going on, prognosis, all that kind of stuff, and then turn it in. And the checks were on auto draft and they just showed up. We never had to mess with it.
Yeah.
Partial disability. So there was 4 months that I was working partial disability, and that's a little hairier
Okay.
because the terms change when you go from full disability to partial. So on full disability, if you've got own occupation, I could still do some lecturing and stuff like that. It didn't really count against me. So I was able to kind of double dip. If you go onto partial disability, now they look at the totality of your income. So
Uh,
they'll only pay out benefits based on a loss. And so if you maybe only are doing half the dentistry that you were doing, but you've been able to supplement your income through something else, rental houses or who knows what, then basically it's going to only be the difference in loss of where you were prior to your disability to where you are now with all of your income, and then they will pay benefits based on that. So that was a little hairy because my expenses were out of whack because I was now paying an associate that had not been in the practice before, and that worked against me. But to their credit, I actually appealed it. I felt like those benefits were being unfairly applied, and they came back and they said, we agree with you.
huh.
The contract does state that we're going to figure it this way, but we see what you're saying, that you're not trying to game the system. We understand your expenses went up because you've got to keep this practice alive so that if you can get well, you've got a practice to go back to. And so I was pretty impressed with that.
No way. An insurance
Yeah.
company actually agreed with someone who tried to fight them to get the money that they were owed. And
It's
wow.
Yeah, I totally did not expect them to. I wrote this big appeal letter just knowing that the answer would be no.
Huh.
And my disability guy would laughs at me all the time because every time I call him, I've got some question. I'm like, Mike, so I'm trying to figure out how they're about to screw me here, because
Uh,
all my experience with insurance companies is how are they trying to screw me here?
right.
And I can say that to this point, I've not had that happen with me.
Well, and that's really good to know, because I know Guardian is kind of regarded as one of the premier ones, and you do pay a little bit more, but it sounds like when it counts and when you actually would need to use the policy, they really came through for you in a big way that allowed you to support your family and support your practice and ride out this awful time without having to worry about how to provide. So that's pretty awesome.
Yeah, very critical to have that. And I would tell people the same thing that I was told: max it out at every chance you get.
And you mentioned that you made sure you paid with that with after-tax dollars, correct?
Yeah, we were advised to do that because if you ever have to get your benefits, if you paid them with after-tax dollars, then that income won't be taxable. So as I understand it, whatever money I'm getting from disability right now is not taxable.
So that's huge. I mean, if you've got a 15 grand or 20 grand payout that every month and you have to pay taxes on that versus not, I mean, that's a big difference. So paying your premiums before you have any claims, and I guess they're pretty strict about it. Like you have to pay every single premium with post-tax dollars is how I understand it. But
yeah, I think that's correct.
And if you do that, then you don't have to pay tax on the premium, on the benefit on the back end if you ever have to use it. So that's important to know.
Yeah.
Well, thank you for kind of sharing some of that. I know that some people are hesitant to get into financial information, but lastly, before we wrap this show up, I wanted to talk about your experience with Blue Sky Bio. So you actually connected me with Blue Sky Bio just recently on Dental Town. I reached out to you and I was looking for potential sponsors for season 2. And you're like, well, they don't really do a lot of advertising because they don't really need to, and that's not their business model. And so I took that as a challenge of like, okay, well, let me see if I can get them on board. And they're awesome. And I reached out to them and I kind of said I would rather make less money or have less, sponsorship overall, and work with an awesome company like you guys. And so they said, okay, let's try it out. Let's do this. But I don't have any direct experience placing Blue Sky Bio implants, using their software, 3D printing, any of the other things they have. So I can't speak to that. So I'm going to try and tell their story through others in the ads.
Okay.
But I wanted to hear your perspective of like, how did you find out about Blue Sky Bio and what have they allowed you to do in your career that is unique to them versus other implant companies?
Yeah, so I mean, as far as their products are just excellent. I mean, I have a slide in my lectures that everybody always gets a laugh out of that says, everybody's implants integrate, some just integrate a whole lot cheaper.
Right.
And so we know at this point what works in implants. We know what surfaces work. We know many of the design aspects that work. So there's no monopoly on making a well-designed implant that's going to integrate and that's going to, do well in the body. So
sure.
Practicing where I do in a lower income area, I realized early on if I was going to be doing many implants, that I would have to do them affordably. I thought I at least owed it to myself to look into Blue Sky Bio because I was hearing more and more about them. So looked into them, actually made a call to their customer service and was asking a very technical question. She said, you know what? I don't know the answer to that. Can you hang on and let me connect you to Sheldon? And so Sheldon is one of the owners of Blue Sky Bio. Sheldon Lerner and Albert Zigman are the two owners. And so she connects me to Sheldon, who's on vacation in Israel, and he picks up the phone and then proceeds to talk to me for 30 minutes.
No way.
And I'm just thinking, did this really happen? I mean,
is Sheldon the oral surgeon or the periodontist?
Sheldon is a periodontist,
okay.
And then Albert is the oral surgeon.
Okay.
And it just blew me away that there was that level of customer service. And then once I knew their names, I start looking and I see that they're posting on Dental Town.
Oh, they're all over.
They're answering people's questions and stuff. He gave me some really good answers, and I ended up going with their Biomax line, which has got the Nobel Active compatible connection.
Okay.
And have never looked back. The other big thing that drew me to them was their focus on technology. So they make the Blue Sky Bio software, which was very transformational for me because I'd experienced guided surgery. I thought it was amazing and awesome, but the cost was just too crazy. It just, again, made no sense for me to do it financially with what I could charge. And so when
let me ask you here. I remember there was an argument between you and Armin about guided versus non-guided surgery on Dental Town. So how did that go down?
I had to bring that up.
Uh-huh.
So yeah, Armin has for a long time been beating the drum of every implant should be guided and whatever. And, I didn't agree with him. For a long time, I didn't have cone beam and was seeming to do very well with my implants. And I sure didn't think you needed to guide them. And so I ended up getting a cone beam. And, of course, Armin is licking his chops. And he says, "Hey, I'll make you a bet." And he does this publicly on Dental Town. And he says, "I'll bet you within the first 20 implants that you've previously placed, when you scan them again, that you're going to find one of them perfed." So I took him up and whatever. And
Sure.
I actually made it through the bet. So I won the bet. But I don't know, 24, 25, around that area, I rescanned a patient. And, I mean, there's a big chunk of it sticking out the apex of tooth. And it was integrated and restored, but it just looked awful. Just a hall of shame. And I wasn't going to say anything, and I get this Facebook message from him months later, and he's saying, "Hey, just checking in on those perfs." And so I debated and finally showed it to him on one condition, that he give me 3 free guided surgery cases, because he owns a Cadre, which is a company that does design and stents and all that. And so he did that gladly. And he also posted a ridiculous thread on Dental Town mocking me. That gave me a chance to try out the guided surgery, and I mean, I was hooked at that point.
Yeah.
And so I knew I wanted to do it, but I had to figure out a better way on the cost. And so that was where the software came in. So with this software, it's free to download. Anyone can get it, and you can take any cone beam scan, and you can design your own guided surgery stents, and then export those to be 3D printed. And so basically now it costs me about between $20 and $25 per case to do them fully guided.
That's crazy.
And at that price, I still never try to make the argument that it's standard of care or that you can't do a good job without a guide. But for me, at that price, I think I'd be stupid not to. It takes me virtually no time. It makes the procedure quicker. It reduces my stress in the procedure. So I think it's a no-brainer.
No, I'm just to the point now where, like, I had a few pretty slam dunk single tooth implant cases where I was like, okay, implants are not so bad. And then did a couple, like 2 implants in a single edentulous space with like a bigger area to kind of lose my orientation in. And man, I started sweating and realizing, like, sure, these little radiographic guides I made like helped me get an initial pilot drill or whatever, but it's stressful when things aren't quite going. You take maybe an x-ray mid-procedure just to check where you're at, and it's not lining up, and it's been a little while in the chair, and now you're sweating a little bit more. I'm more and more excited about when I can get my own 3D printer and load up the software and start doing things on my own, because it's just like, it works and it's fine. And it's like, yeah, it's still restorable, but it could be better.
Yeah, totally. And I mean, I tell people in our course, I always try to make the argument for why should you consider guided surgery. And so for me, a lot of people say, well, I just need the cone beam. Well, at least for me, the problem wasn't knowing where the implant needed to go. I mean, I had the cone beam, I could look at the scan, and I could tell where it needed to go, but it's actually getting it there. You know? I mean, you might be trying to start an osteotomy in a sloped ridge or whatever. There's all these complicating factors. And just knowing where it should go doesn't mean at all that it's going to go there. And so I like the idea of a restrictive guide, even if it's nothing but to get your initial pilot drill on track. And then maybe you freehand after that. But I like the idea of setting it up where you're not going to screw it up right from the beginning. Because once you've set the initial penetration site and trajectory and all that, you're home free for the most part.
And if you do it wrong, you might not have great primary stability, and you might be doing what I was doing and just praying and closing up and hoping it integrates. So, and another thing you brought up was on Howard's podcast was right-handed versus left-handed, or the right side versus the left side, that no matter what you do, it's going to be easier for you to place implants. So if you're right-handed and do dentistry from the right, is it going to be easier on the right side of the patient or on the left side of the patient to place implants?
For me, it's much easier on the side that I'm working on. So I'm a right-handed dentist. I sit on the patient's right, and my right-handed implants are money, and my left-hand implants are sometimes not so money.
Sure. Yeah. No, and I didn't even think about that, but like it was exactly the case that my first couple, I had everything lined up. They were on the right, and then I went over to do the left on that same patient, and that's where I started struggling. So it's little things like that. We don't even realize why this surgery is more difficult than it needs to be. And if it was guided, then it wouldn't be.
Yeah.
And
Armin likes to always show in these videos how he'll actually, with these restrictive guides, he's right-handed, but if he's working on the left, he'll do the procedure left-handed because the guide is so stable and it's making him follow where he needs to go. So that's a pretty big testament to being able to do it fully guided.
So I haven't. I mean, I'm going to download and mess with their software because it's free. And eventually I plan on using it, but right now I don't have a way to integrate it into my current flow of how we're doing things in the Army. But how easy is their software to use? Like when I think of like free software, I think of like the open source stuff that's kind of bare bones and it works, but it gets you there, but it's not pretty. Is this and what are the alternatives and what do they cost? So I don't have to look at costs at all right now because it's like I have to use what the Army tells me I have to use. But what what would you say in comparison to other softwares and things like that?
Well, so the business model is totally different. With most of the other systems, you're first going to have to buy the software, and I've heard those range anywhere from $5,000 to $10,000.
Okay.
And then many times you also need to buy their kit because they're dedicated to a particular type of kit or whatever. There's not the ability to make it work with whoever's drills you want. You don't have control over enough parameters in it. So there's that aspect, and then there's oftentimes an ongoing yearly fee, and then there's a per case fee. So the craziest thing is some people are paying $5,000 for software with a yearly update, and then $200 per case that they do. It just boggles my mind, but they're still doing it.
Right.
And so with Blue Sky, the software is free. The only time you incur a charge is so you design the guide, you've got to export that guide. So if you choose to export a guide, it will take away one export. So you buy these exports, it puts them in the computer, and it just takes one when you do an export. It's just one per case. And those, depending on how many you buy at once, it'll range from $15 to $20. So that's your primary cost in doing it with Blue Sky's way. So no upfront cost and very minimal per case cost of $15 to $20. And then you have that 3D printed. I have 3D printers. It cost me 15 cents to print a quadrant guide on my little Robox printer, which was $1,500.
No way.
Yeah, so there's a lot of printers you can buy, and a lot of people are going that direction. But even if you outsource it, there's a number of good places that will print for you that it's pretty affordable. So that's your cost on it. As far as learning to use the software, so I tell people it's a lot like comparing Photoshop to like Picasa Photo Viewer or Windows Photo Viewer. So if you've used your Cone Beam, most of those have their embedded software, and that software is for viewing and whatever. Maybe if it's like Sorona's, you can actually generate a guide, but it may look sleek and sexy.
And you can often place quote unquote an implant in that, just kind of orient something in there.
Place it. Absolutely, yeah. And so it's got these very basic functions, but you just really can't do much with it. And so I would kind of liken that to Picasa or Windows Photo Viewer. Whereas you look at a program like Photoshop, Blue Sky Plan is more like Photoshop in that it is a huge, robust program, extremely powerful, that will let you do anything in the world you would ever want to do. I mean, we're designing now. I was just, before you called, I was helping design a stacked bone reduction guide with a stacked on drilling guide, and then a transitional prosthesis with pre-made holes in it that I'm making pretty much mostly from Blue Sky Plan.
Oh, wow.
So
I don't even understand what half that is. We don't need to go into it, but that's pretty awesome.
So yeah, but way more powerful. With that does come a bigger learning curve. So it's a little tougher to learn than, say, your just basic viewing software that maybe came with your Cone Beam, but you would expect it to be so if it can do all that. So the learning curve just depends on the person. We have people in our courses that from day one are just all over it. They can teach themselves with just some online videos, and then other people need a little more hand holding. It's just a matter of knowing where all the little buttons and stuff are.
Sure.
How do I turn this on? Or how do I make this disappear? And once you learn that stuff, now that I know the program and am proficient with it, an average 1 or 2 implant case is going to take me around 5 to 6 minutes to plan and design the guide. And then within another minute, I can have that printing on my 3D printer. So I would spend that long looking at it on cone beam viewing software. It's just a few more pushes of the buttons to generate a guide. So I don't really think time is a valid reason not to do this. I mean, if you'll go through the learning curve and learn how to use it, it's not going to be a big investment of time.
Okay, cool. So it's just that much more powerful and allows you to do that much more, but you're going to have to learn how to use it, which is perfectly reasonable.
Sure.
You have something, so you kind of were associated with them officially in one capacity. They reached out to you when you were out on chemo, and I thought that was really cool of them that they did that. So tell me about that.
Yeah, so I mentioned to you I was very impressed that they would talk on the phone with one of their customers or a potential customer at that point. Once I started getting into the guided surgery stuff, I began talking with Sheldon and Albert more, and working with them a little bit on the development of the software. And just super guys. I mean, as good a guys as you could ask for. Always want to help. I can't say enough good things about them. So I was giving courses at that time, and we talked fairly often. And then I got this leukemia deal, and so it was funny. I don't know if this was maybe a month or 2 months into treatment, but I'm sitting in the hospital room, and we have some friends there, and I'm kind of joking, only not so joking, about how disability hasn't kicked in yet, we don't have any money, blah blah blah, and I'm going to be in the poorhouse, and whatever. And I get a call as I'm saying that. It was Sheldon, and he says, "Hey, I know you're probably bored to death in there. We're kind of covered up with customer service and all this stuff. It's just me and Albert. You know the product line as well as anybody. Would you want to, just from your hotel room, take customer support calls and emails? And, we'll pay you
I mean, literally,
so
like,
much."
what else could you do in dentistry from a hospital bed or hotel room or wherever you were at that time?
Yeah. So these guys, they sought out a way to help me, during that time, and I think it helped us both out. I was able to take some of the load off of them for customer service because most questions I could answer, and if I couldn't, I would kick it on up the ladder. But it was a very mutually beneficial thing for us, and very generous of them to do that, and provided me some income throughout basically my whole time in chemo. So I ended up working for them for 6 or 8 months in that capacity. So we still work closely together now, not so much in that capacity, but I do speak for them sometimes. I still teach courses independently, but on their software. And so we work very close together and have a great relationship.
That's awesome. That speaks volumes to kind of who they are and what they represent. And you do a little bit of, there's a online academy, right? You've got a Blue Sky Academy, and that's kind of sponsored and associated with them, but not directly under them. That's kind of more of your thing. Is that right? How does that work?
Yeah. So originally it was myself and Armin started that. We've got a number of other people involved with us now, but that is basically the online component to our live courses. So we teach these live courses in learning the guided surgery workflow and how to use the software and how to do the surgeries and all that. But for a lot of people, like myself, half the stuff I've learned in my career, I've learned on Dental XP and Dental Town and just online.
Yeah.
I'm very good at self-learning. I don't necessarily have to go to the course, where some people really need to go to the course but can't sit and do it online. So we just wanted to have both options. So Blue Sky Academy kind of evolved out of that to be an online resource where it would be paid membership, and we would have a pretty exhaustive video library that you could go in and just step by step learn this process, and then all the way up to these advanced techniques and live surgeries that you could watch. So yeah, that's been fun and interesting, and we're still working on always putting more content on that. But I think that's a really beneficial tool for people wanting to get in this as well.
No, and that's one of my favorite things about online education is you talked about having to shut down your practice to go do this IV sedation course, and looking at all the costs, it's the opportunity costs are worse than the actual costs of things. But then when you do it online, oftentimes they're more affordable for the volume of content and the quality and the rewatchability. I can't even remember. I was looking at the pricing the other day. There's a couple different levels and options for the Academy. How does that work?
Yeah, so just to become a member, it's $1. So that basically gives you access.
That's pretty steep. I don't know, man.
I know.
It's rough.
That's basically to keep the porn spammers out.
Sure.
If they have to pay $1, they're not going to join. So that just gives you access to the message boards and all that. You can post questions on there, and people will chime in. The next level up would be the one that has all of the videos.
Okay.
And so that one is $550 for the year, and then I think recurring yearly after that is like $300 a year.
Okay.
I have to double check that, but that gives you access to everything in the site, and then you can also do things a la carte. And so we've got some really good 3D printing videos. So maybe you know how to use the software, but you don't know about 3D printing. I think it's like $150. You can get access to all the 3D printing videos, or there's a mesh mixer forum. There will be orthodontic forum with the development of this new ortho software coming out in a few weeks. And so we've got all these levels. And then the highest level, I think, is $950, which is still access to all the content on the site, but you also get personalized help in designing and carrying through your first 5 or 6 cases. And so
you're going to fly out and hold my hand during the procedure, right?
Not so much that.
Okay.
I'll virtually hold your hand.
Okay. Fair enough.
Yeah. So, yeah, that's kind of how the levels work.
That's awesome. And it's awesome that you guys have kind of opened up the forums and the support to, everyone but the porn spam bots. And then from there, people can really take what they want and a la carte or membership. So that's an awesome service you guys have. So thank you for kind of coming on and helping me convey what a good company Blue Sky Bio is and what they're all about, and why they can do things the way that they do things, and why they can be so affordable, and why they can be so helpful and provide things the way they do. Because I don't get to place them right now, and I will in the future, but I appreciate you introducing me to them via Dentaltown and through your videos and everything online, and also just kind of everything you've put out there. So thanks for being on the show, and I had a lot of fun today.
Yeah, man, I did too, and I appreciate you having me, and good luck to you and all your endeavors with finishing up residency and getting out there and getting after it, man.
Awesome. Cool. Hey, I'll talk to you later, man.
All right. See ya.
Okay, I hope you guys enjoyed that, even though we got a little clinical, and you've heard maybe a little chunks and pieces of that interview in ads before. I'm on a mission as a dental podcaster to prove to companies that podcasting is a viable source of advertising, and in fact is way better than print ads or emails that people ignore and look over. That's what supports this show. And Blue Sky Bio took a risk by agreeing to advertise with us. If you could do me a huge favor, if Blue Sky Bio was not on your radar before, or maybe you'd heard of it but you didn't really understand what it was or what they did, and now because of this podcast you are planning on using them in the future, you've downloaded their software, or maybe you've even ordered something, if you could email the general manager, John Cory, and tell him that this worked for you, that this was more convincing than just advertising on some journal or somewhere else. Tell him that, hey, I'm interested in Blue Sky Bio because of the Shared Practices podcast. His email, I'm going to have it in the show notes, is jcary@blueskybio.com. So that's JCARY @blueskybio.com. And don't expect a response. He's been, kind of busy running a company. So email him and say, thank you for sponsoring Shared Practices. I love that podcast. It's great that you guys were doing that. And now I'm interested because of that podcast. And that gives us a lot of credibility. So if you did that, that would be awesome. jcarey@blueskybow.com. I'll give you a second right here. Go do that. Thanks. And I promise I'm going to release one more episode this weekend. We're going to kick off a month of interviewing Dr. Hunter Smith about acquisitions. And he bought 5 practices in a very short period with his partner out of dental school within a couple of years, and is now helping others do the same thing, either buy their first practice or buy multiple practices. He, hands down, is an expert, and we're going to get really deep into valuation and what to pay, what price, what terms, what really matters when looking at a dental practice to acquire. And at the end of the month, we're going to have an episode where we go over the financials of practices that people have emailed to us over the last month or so and digest what the real financials look like and what he would offer and how that would change based on who you are and your specific needs. It's going to be pretty awesome. So we'll talk to you soon on the Shared Practices Podcast, Season 2.